excited about the growth. Um, I don't know if you all have heard by now, I've been fighting for the last 4 or 5 years to get the small disadvantaged minority business contracting and certification under the commission. We finally got it. So now we are revamping and restructuring so that we can grow in those particular areas, which means that we will be reaching out to all of our advisory committees to help identify some of those businesses that we can go out and help along the way. We have a new program manager, program coordinator. Nicole, are you on?
I'm here. Sorry, I was muted.
All right, very good. Nicole Palmer is our new program coordinator. Ashley Owens left the agency. Um, being a military wife, you have to go wherever your husband goes a lot of times. And this was a situation that she had to, uh, decide to do. So she and the children moved to North Carolina where her husband is stationed. And she did a great job as our coordinator. And we've passed the torch now to Nicole. Nicole has just started recently, so she's learning. So be patient with her and help her along the way. Make sure that you get to know Nicole so that she can be involved in the activities that you have going on in the various communities. Um, before I let Nicole speak, one thing I wanted us to look at, South Carolina State University. Dr. Gua, how are you? Two of the students, Alexis Day and Aaron Smith, have just been selected to serve
White
the
House.
2024 HBCU White House Scholars Program. That is such a great honor for these students. There are a lot of negative things going on out there. So therefore, we have to overshadow those things by talking about the good that's going out, because there are some great things going on. That White House program is geared towards HBCU students. These two people are now ambassadors to the White House, and they will now be exposed to so many new opportunities. That's why these are the kinds of conversations we need to have. These are the kinds of celebrations we need to participate in, because if we don't build up and encourage our students, no one else will. So therefore, hats off to South Carolina State University for having students. There were only, I think, 110 students around the world, and 2 came from South Carolina State University. That is a great honor. And I will be calling the president to see if there's anything CMA can do to help elevate these 2 students to the best of our ability so that they know that we are behind them 100%. So hats off to South Carolina State University. Nicole, you want to give just a brief update? I know you've just started, but maybe you have something to share with the group.
Okay. Hello, everyone. I am Nicole Palmer, as she mentioned, the new program coordinator for African American Affairs. The updates that I have so far, just piggyback off of Ashley and what she's been working on. Next month, she is hosting a Second Chance Housing Forum, partnering and collaborating with HUD. We reached out to Deborah and we're waiting to hear back from her for that. In November, we are sponsoring Early Childhood Common Agending Housing Summit. And I'm collaborating with the AAPI coordinator, Christine, on that one. February 2025, we have Black History Month celebrations. Currently working on that. Don't have anything specific as of right now. In March, we have the Historical Minority Figure Art exhibit that I'm also collaborating, partnering with Christine, our AEPI coordinator. In the Dillon area, we are looking for an elementary to participate in that project. And we are focusing on the Dillon area, as I said, and we're going to go out in a couple of weeks to meet the principals and pass out letters and give them more information about that so we can choose what elementary school we would like to do that with. In April, we have the Second Chance Reentry Program. Let me see. I'm sorry. That one, we're also partnering with HUD to discuss the importance of renting to those formerly incarcerated. HUD will invite the local housing authorities and other community members to have that roundtable discussion. We also have the Multicultural Author Roundtable happening in April 2025. We'll have one self-published author from each multicultural division, as well as 2 in-state publishers. That will sit as a panel for a Q&A session that is open to the public. The purpose of this author roundtable is to showcase the journey of each author that they took to share their story and to inspire others to do the same. And also in April, we have the Black Maternal Health Forum. That's going to be a media project. We're going to collaborate with research and communications to produce a social media content to bring awareness to the Black maternal health crisis. We're also looking to partner with external organizations such as Prisma, DHEC, or a local nonprofit. And also in June, she was hoping to sponsor with the Juneteenth Freedom Fest. I have to get back with Ashley on that one to see what she was going to do with that, but that's it as far as the updates for the program.
Very good. And we will put together calendars and email it to all of you so that you can see the future dates that we have already scheduled events. And if there's something that you would like for us to participate in, get that information to Nicole and we will work it into our calendar.
Yes.
One thing I want to mention is that September 4th, I celebrated 6 years here at the Commission for Minority Affairs. When I started, Norma Brown, you were always around. So that's a great thing. We've known Norma for, I guess, as long as I've been here. And that's a wonderful thing. We've grown from just under 9 people to just under 30. We're just below 30 as far as FTEs are concerned. We have expanded our office space. We are in the process of expanding our reach. I am hoping to place satellite offices around the state. We're hoping to work with the technical colleges to look at just small office spaces to have a Commission for Minority Affairs office that'll focus a lot on outreach and our small business contracting. Those are some of the things that we're looking forward to doing. And to help us do that, Brenton's going to talk or introduce someone who's helping us to put our strategic plan together for the next 3 to 5 years for the commission. So I'm going to turn it over to Brenton and allow him to introduce Alexis.
Good morning, everybody. It's a pleasure to see you all again. Once again, my name is Brenton Brown, Chief of Staff here at CMA. It's my pleasure to introduce Ms. Alexis Scipio. She serves as the Director of Course Development for Global Course Strategies and Consulting, LLC. GCS, as it is known, is a leadership company with a mission to consistently deliver impactful leadership development services. They focus on prioritizing client needs such that those clients can make a tangible difference and foster a culture of success. And so the agency has employed their services to assist us with facilitating our strategic plan for the next several years. And so without further ado, I will ask her to come on so she can talk a little bit about what she will need from you as advisory committee members to be able to assist the agency. Alexis?
Thank you, Mr. Brown. Thank you, Dr. DaCosta, as well, for having us. Again, Alexis Scipio. I represent Global Core Strategies and Consulting. So just so you know, everyone can take a breath. Today, I'm purely here in the posture of observation. As Dr. DaCosta noted at the opening of the call, you guys have had some real exponential growth as an organization, and that's fantastic. But with exponential growth, you have to have this period of alignment, making sure that all the hard work you're doing in those core initiatives is matching and pairing with the strategic vision of the next 3 to 5 years. So that's what we've been contracted to do. The advisory councils are such a critical part of this organization. And I know that they wanted to make sure that your voices were properly captured, to make sure that you are engaging in the way and bringing yourselves in a way that you feel you're a value add. So I'm glad to be here because I will send out a select few emails, and it was important for you to have a face with a name, as I know everyone is so busy. But again, thank you for having me, and I look forward to this wonderful work. We're excited.
All right. Thank you so much, Alexis. So you all will be hearing from Alexis. She's going to select a few advisory council members. What we're hoping to do is have some more community engagement involving our advisory council members. We need to be out and about more. We need more activities, more participation with staff and our advisory council out in your communities. We want to take advocacy to a new level. And to do that, we have to have the guidance, the proper training, and what have you, to make sure that we are hearing the voices in our communities. One thing that we're going to do, aside from getting the strategic plan in order, in December, you all will get some more information about this. We are going to have a one-day retreat with advisory councils. We're going to have training. We're going to bring in folks to talk about advocacy, collaboration, and whatever we need to do to strengthen our reach into our different communities. It is going to be imperative for our advisory council members to give us the input that we need so that we are addressing situations, issues properly, and not overlooking anyone. Excuse me. So please be prepared for information on that training retreat, and be prepared to hear from Alexis. She will get your email addresses, and she may send you a few questions, and we'd like for you to answer them as clearly as you can. We're trying to make sure that the commission is the voice for all of our communities that we are representing. So therefore, it's going to be great for advisory councils to be active in this strategic process. Any other business for the commission? Anything from the advisory council members?
Yes, I had to say something. First of all, if it's okay,
Sure.
first of all, I'd like to thank the commission for the generous donation you gave to the young CEOs and leaders, and also for allowing them to present the day before they did their Shark Tank. They presented to you, and you have no idea how much that helped them. The money that you gave, in order for them to be in the camp, they have to have a computer. Because they have to do a business plan, and some of them didn't have laptops. So the money that you gave us allowed us to get laptops for the kids that did not have laptops, and they
Very
were
good.
awesome. Also, just wanted to say in Brenton, we got T-shirts, and Stand on Business and Vote is our campaign. And Brenton was there, and they came to hear Mr. Antoine Seawright and James Felder, Mr. Felder, and they were trained on the machines. And the majority of them signed up to work at the polls. So we're
Okay.
doing a registration contest, whoever can register. So I know I just heard from Ridgeview, and I had a student from Claflin who was a young CEO long time ago. So they're going into the schools in the community to see how many people they can get to register. We'll focus on registering in September and October, getting people out to early vote. And then we're going to be in a parade for anti-bullying, and they're going to do something with the pop-up shops. And so we're really busy, and we partner with Mercy for community service in December. And then, of course, we're working, and we're excited about 2025, the opening of Aim High Charter School. So I
Wonderful.
thank you so much for the commission, for all the support you give to the young CEOs, and they got me worn out. Very
Very
good.
good. I cannot wait for the charter school to open up. I'm excited about that venture. I know that it's going to be great. You're going to have lots of participation, which is wonderful. Now, will this be a full-time charter school year-round?
Yes, it'll be a full-time charter school year round. It's aim high. The A is for the arts. We'll have the arts. The I is for innovation, which I'll be doing the School of Entrepreneurship. And the M is for media technology.
Nice.
So prayerfully, we'll lock down a location very soon and we'll be ready, but I'll keep you updated.
Wonderful. Thank you so much, Norma, as always. Thank you so much. We definitely want to keep our eyes on that so that if you need our help in any way, we are available to help you along the way. Anyone else on the advisory committee? Any comments?
Well, I hope my line's clear enough. Good morning.
Good morning.
Just a brief update, a few things going on in addition to opening and regular school starting. We're gonna be doing some construction, as you've heard. They've given us some money to rebuild Turner Hall into an academic institution that looks different from what was built in 1914.
Right.
Of course, our president has started an initiative for improving customer service. It will be good to hear because lots of our customers have complained over the years. So we've got a company from up north, Massachusetts, the BSAG. They gave a training to all the deans and vice president last week, and they're doing training of the trainers, and the goal is to overhaul the entire customer service of
Very good.
SEC, which we all agree need to improve because over the years when we didn't have or had our own problems, things got worse and customer service bad, very, very bad. So those are kind of a few things that going around campus. Of course, students in school, and as you just heard, 2 of them will be going to the White House to represent HBCUs, and other things happening around here. Delighted for you, Dr. DeCasa, and we look forward to another dozen year at least.
Absolutely. Absolutely. I've got to get on your campus. I saw the president at the groundbreaking for the museum and the dorms that are coming on at the railroad crossing. And I told him that I would be coming by to talk with him. I haven't visited a school since he came there. So I'm going to put it on my calendar to call to come and see him and to see some of the good things that are going on at South Carolina State University. Thank you, as always, Dr. Gould. You've been around CMA for how many years now?
Oh, what's that? Is that 2015? Going to 10 years now.
Long time. You've been a friend of CMA for a very long time, and we appreciate you. Anyone else from the council? Do we have any other HBCUs represented?
Dr. Costa, I have an update.
Okay, very good.
Good morning, everyone. Good morning, Dr. Costa. I feel like those 6 years have flown by, and I know time has sped up with COVID, but congratulations on 6 years. Definitely wish you many, many more with CMA.
A few more, not many, but few more.
Okay.
A few more. I'm gonna give it just a few more years, and then I'm going to pass the torch because I'd like to enjoy my retirement at some point.
I understand that. I understand that. Just wanted to give you all a heads up, very baby step process, but doing some work around college food insecurity, have brought together several institutions in both South as well as North Carolina to look at trying to improve college food insecurity and looking at trying to get more students who are eligible for SNAP approved for SNAP to make that process easier. And wanted to let you all know one of the things we've looked at is they have Tennessee, the state of Tennessee has created, I want to say it passed in 2022, a bill where all state funded institutions have to respond to a food insecurity survey.
Okay,
And the Commission on Higher Education produces that survey and provides an annual report. I will let you all know
very
college
good.
food insecurity is one of the highest markers of food insecurity out of all populations.
Yes,
Very little research in this area, very little data in this area. Schools don't know what other schools are doing. And so we are trying to come up with a pilot. It was recommended maybe try to come up with a pilot survey before trying to push something similar like this in the state of South Carolina to already ascertain data from institutions. So would love for CMA to help us make sure HBCUs are represented in that report so that we can start finally painting a full picture of what does food insecurity look like on college campuses in
sure.
South Carolina. And then the next step, once you have that data, is how then can we get resources to be able to support really making a dent in the issue. So just wanted to give you all a heads up. Very early stages, but once the time comes where we have a pilot survey, would love y'all's help and helping make sure the colleges, particularly HBCUs, respond to that survey.
Okay, wonderful. Just keep us in the loop and we will gladly do our part. Thank you so much. Anyone else from our advisory council? Anything from staff? All right. This is a quiet group this morning, and I kept my word. I wanted to keep it between 30 and 45 minutes. We are below the 30-minute mark, and I think that we've given some great updates. Be on the lookout for the invitation for the training in December. It's going to be a retreat/holiday training kind of thing. It'll be our end of year event where we bring in, we do some training, bring in some consultants, do some advocacy and collaboration training, and we will end up with probably advisory councils joining in with our board. We want the board to meet the people in the community, our council members who are actually our foot soldiers, our ambassadors in the communities, keeping us informed on what's going on in and around the state of South Carolina. So be on the lookout for that information and any other information that you would like for CMA to share or any event you'd like for us to be a part of. Please feel free to send that information over to Nicole, and we will certainly do our best to be a part of whatever you're doing. Our job is to make sure. Oh, Alicia, were you doing a presentation this morning?
Yes, ma'am.
Oh, well,
I'm sorry, I forgot to add that to the agenda. I apologize.
well, Alicia, good thing you spoke up. Alicia Page, she is one of our research analysts, and she's focusing a lot on maternal health.
Yes, ma'am.
And so I'm going to go ahead and I'm glad you said something because I was getting ready to say amen and close out the service. So Alicia, go
it's
ahead.
perfectly fine. Let me go ahead and present it. And I do apologize, everyone. I'm actually recovering from a bronchitis flare-up. So if I sound stuffy, I do apologize. Here we go.
All right.
All righty. So the failing of Black maternal health. Good morning. As Dr. DeCosta stated, my name is Alicia Page, and today we will be discussing Black maternal and infant mortality. I will be presenting analyzed data that I've collected to help create a clearer picture of some of the disparities within our healthcare and socioeconomic system in South Carolina and how they directly affect Black mothers. On today's agenda, we will define maternal and infant mortality, understand the difference between mortality and morbidity, discuss key factors in maternal mortality, explore our first focus zone, the PD region, and at the end, I'll answer any questions and listen to any feedback that you may have. What is maternal mortality? Though the definition for each word individually is simple, when combined, they become complex. According to the World Health Organization and CDC, maternal mortality is defined as the death of the mother during the pregnancy or up to 42 days after birth or termination. The Commonwealth Fund defines maternal mortality as the death of the mother during pregnancy or up to 42 days to a year after birth or termination. Because there are multiple definitions, any death that occurs 42 days after termination or birth is defined as a late maternal death and is not included in the calculation for mortality rates. Here explains the levels of maternal mortality created by the Commonwealth Fund. The first level is maternal mortality. That is the death of the mother during pregnancy or up to 42 days after birth or termination. Level 2 is pregnancy-related mortality, which is the death of the mother during pregnancy or up to 1 year after the birth or termination. It is directly related to the pregnancy. Level 3 is pregnancy-associated mortality. This is the death of the mother during pregnancy or up to 1 year postpartum. While the death may not be related to the pregnancy, it is associated with it. Infant mortality is defined as the death of the infant or the child's first birthday. In 2023, the annual infant mortality report was released, revealing that the number of infant mortalities rose by 12% and grew nearly 40% for infants born to non-Hispanic Black mothers. Currently, the top 3 factors that play a direct role in infant mortality are congenital malformations or birth defects, disorders related to short gestation and low birth weight, and lastly, causes related to maternal complications of pregnancy. As we know, mortality is the death of the mother or child during pregnancy or 42 days up to 1 year after the birth or termination. Morbidity is when an unexpected health condition is attributed to a complicated pregnancy or birth. It has a negative impact on the well-being and function of the mother and or child, resulting in short to long-term health complications. Now that we understand what maternal and infant mortality is, let's watch Deputy Director Sheely's interview with Fox 24 on April 22nd of this year concerning the issues surrounding Black maternal and infant mortality in our state.
No sound. The sound is too low.
Mm. Can you hear it?
Nope.
No, we're not able to hear it.
You're not? Okay, let me see. Let me see. I do apologize.
Well, I would just
Do you want me to
bypass-
just, yeah, I'll
bypass
bypass
the
this
video
one.
and you can send it out if you'd like to.
That's what I'll do. Okay, so these numbers represent approximately 18,528 Black women who gave birth in South Carolina, compared to the 35,755 white women who gave birth. Despite the number of white women giving birth being roughly 2 times more than Black women are still 4.2 times more likely to die from complications during or after birth. One thing that Deputy Director Shealy stated during her interview is that there are different factors that play a key role in mortality rates for mothers. The top 6 key medical risk factors that play a key role in maternal and infant mortality are mental health conditions and substance abuse disorder at 15%, thrombotic embolism when a blood clot forms in the vein at 13.3%, cardiomyopathy when the heart loses the ability to properly pump blood at 13.3%, infections at 11.7%, hemorrhages at 11.7%. And lastly, cardiovascular conditions like heart disease and congestive heart failure at 8.3%. Currently, 3% of women between the ages of 18 and 44 have been reported diagnosed with cardiovascular diseases, and 16% medically diagnosed with high blood pressure. Another risk factor that wasn't listed is the lack of prenatal care given during the first trimester. The first trimester is the most critical time for the mother and infant because 80% of miscarriages occur during this stage. Roughly 24% of the women will not receive prenatal care in South Carolina. There are also socioeconomic factors that come into play as well. The top 5 that I have found have a great influence in South Carolina are women living in a high poverty or rural area, lack of accessibility to proper healthcare due to hospital closures and poor road conditions, poor quality of life and health due to lack of screenings and preventative measures, lack of education attainment and education on their medical status and condition, and last but not least, racial discrimination, which can be seen in the healthcare system in numerous forms. So now that we are aware of the issues, what preventative care measures are in place to help alleviate them? South Carolina currently has 3, and they are maternal hospital facilities. These hospitals are divided into levels to ensure that they are equipped with all the necessary tools and masters of their craft. Currently, there are 38 hospitals in total with this ability, and they are divided into 3 levels. Level 1, there are 10 out of 38 hospitals, and these facilities can provide the basic care needed and required for healthier pregnancies. And as you can see, these hospitals are located in each region, both in the upstate, Midlands, PD, and Low Country. Level 2 hospitals care for more complex pregnancy complications, and they are also located in each region of South Carolina as well. And these consist of 21 out of the 38 hospitals. Level 3 consists of 7 hospitals, 4 of them being the regional centers. These facilities admit and treat only high-risk pregnancies and house a trauma and neonatal unit in each one. As you can see, there are only level 3 hospital centers in both the upstate and PD region. We've talked about the state, and now let's venture into a region to get a better, unique, individual understanding. The PD region is not shy when it comes to disparities, and with the current socioeconomic standing in that area, bringing light to this issue is just the beginning to bringing a positive change. Currently, the PD region has the lowest life expectancy in the state. Along with a low life expectancy, it also houses the second highest pregnancy-related mortality rate by region. The socioeconomic risk factors are similar to the rest of the state. However, they do differ. The leading 5 risk factors in the PD region are lack of transportation, work schedule not flexible enough to accommodate appointments and emergencies, can't afford deductibles or copays for procedures and routine appointments, lack of local healthcare services due to hospital closures and lack of facilities, or no insurance or ability to pay. Despite the higher number of Black maternal and infant deaths in the state, majority white women were recorded living below poverty in the PD, upstate, and Midland region compared to Black women in the low country, upstate, and Midlands. Now that we are at the end, if you have any questions, concerns, or feedback, I'm all ears.
Do we have any questions? All right. If you think of anything, Alicia, will you put your email in the chat so that folks can send you questions if they think of something later? This is
Yes, ma'am.
This is the kind of research that we do here at the commission. It varies from healthcare, education, economics, housing. We try to paint the picture of the impact in our minority communities, different things, and the mortality, the death of women, particularly women of color in 2024, dying at childbirth or right after childbirth. Those are numbers that we need to be aware of. And why healthcare, the role that healthcare plays in either having a healthy pregnancy or having a pregnancy that leads to death. So we appreciate you, Alicia, for sharing that information. And like I said, if you have any questions for her, her email is in the chat. Please send it to her. And if there's something you'd like for her to focus on in that particular area, please do not hesitate to let her know. Any other questions, concerns, anything from staff that I omitted? All right. Well, we thank you all for being a part of the quarterly African American Advisory Council meeting. We look forward to your comments regarding our our strategic plan and some of the things that you'd like to see CMA doing in your communities. And we will look forward to seeing you in December. You will get that information. Hopefully by October, you will have the date and time and location and what our goal is and for having the retreat, the training retreat for advisory council members and our board members. If there's nothing else, you all enjoy the rest of your week, and please feel free to reach out to the commission if you need help with anything. We'll see you all in a few months.
Thank you.
Thank you.